Welcome back. Time for one of our favorite segments called What's Going Around. And each week we bring in a local doctor to talk about what illnesses and issues patients are coming into their office with. And today we're joined by Dr. Katherine Enos with MGC Family Medicine in Five Forks. And we thank you so much for being with us. And we know that there are a few illnesses you've been seeing lately in the office. And one of those is Pinkeye. And it's something that anyone with kids, you know that can be an issue, but really it can impact anyone in the family.
Absolutely. It really could affect anybody of any age. So
yeah. And are you seeing more cases, and would we see more cases this time of year?
Typically, yes, because there's several different causes of pink eye. Some are bacterial, some viral, and especially with the allergy season being approaching us, several more cases have come around.
And so people come in and they may say, okay, this is driving me crazy. And pink eye is such a tough one because you want to mess with your eyes and touch them, and that's the worst thing you can do. So there are definitely some things to do to avoid the spread because it's very contagious.
Absolutely. So it's spread via direct contact. So either touching some sort of secretion that's infected, or if you're spreading it via cough and cold symptoms, you can spread it between person and person. So hand washing, making sure you have good hygiene, avoiding touching your eyes if you are infected, and trying to prevent it from spreading to others. Which
is really good. All very good points to make. And you talked about some of it being related to allergy season, but this is the beginning, or what we're starting to see. Our meteorologist Kendra Kent just a little while ago put up just the allergy readings for right now. It is a problem during this time of year.
Absolutely. So allergic conjunctivitis or pink eye can cause some of the same symptoms as viral or bacterial conjunctivitis, and you really just treat the symptoms that you have, whether it be the itching, the redness, same way you would treat allergy symptoms.
Yeah, something to really think about for sure. Well, we really appreciate our viewers sending us some questions. We've gotten a couple of them on Facebook, including this one saying, from Misty, my daughter is experiencing green mucus, chest burning, coughing, dry mouth, and being very thirsty. And Misty, we hope your daughter is going to feel better very soon. But she was wondering more about, what are those symptoms? What could that be?
It really could be so many different things, and it would be important to get evaluated either at an urgent care or by their pediatrician. Most commonly common colds and upper respiratory infections. Sounds like it's what's going on, but anytime when they're very thirsty, we worry about dehydration in kids. So it's a good idea to get checked out.
Yeah, and really important to address that. You don't want the dehydration to go on very long at all, because then it can be too far gone and you've got to go to the hospital at that point.
Absolutely. So when you can stay ahead of hydration by taking it in orally is always best, so you can avoid having to get an IV.
And we do have another question we wanted to pass along too, and it has to do with fever and body temperature. At what body temperature should you worry about it being too low? Jennifer says, I hear a lot about fevers, but not much about the other extreme, about having a low temperature. What about that?
So that's very true. Hypothermia or low temperature could really be a symptom of many different things. Could be just as much infectious as high temperatures are. We always say everybody is 98.6, but that's not really the case.
Right.
So hypothermia is technically below 95, whereas a fever is above 100.4. And it really depends on how you're checking your temperature too. There's so many different tools that we have now besides just oral and rectal temperatures. There's the forehead scanner, the ear reading. So those are not as accurate as core body temperatures, but yes, low body temperature is just as worrisome.
All right. Well, very good advice. Thank you so much, Doctor, for being with us this afternoon. And remember, if you have any questions that you'd like to ask a doctor in our What's Going Around segment, you can post it to our Facebook page and we'll get to it coming up next week.